to Medica Nova Wellness Studio. I'm Dr. Angelika Koch with the educational videos about optimal health and the most innovative and holistic approach to your well-being. Hi everybody, after 12 weeks absence, I'm finally back. Some of you maybe remember that I mentioned in a previous video that I was preparing for quite a grueling exam, which is now over. Not quite sure how I did, still waiting for the results to come in, but God, it feels good to be back. In this month's video, let's take a look at how you can heal and manage juvenile arthritis with natural and effective therapeutic tools. Juvenile arthritis affects nearly 300,000 children under the age of 18 in the US. It's also called juvenile idiopathic arthritis, meaning of no known cause. They don't know why it's happening. There are other forms of arthritis affecting children as well. Characterized as an autoimmune disorder, some specialists believe it has to do with the child's genetics, so the parents have passed on the genes to the child and the child is susceptible in getting arthritis, or there's a virus involved, environmental toxicity, so many other factors and choices. Enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. And thank you so much for your thumbs ups or your likes, as they all help me to grow my channel more. If you're interested in learning more about how to apply homeopathy among your friends and your families, about mental health, health coaching, quantum healing, and so much more, go to my website medicanova.net at the online academy, where you will find comprehensive, certified, university standard home study online courses. So what is juvenile arthritis? According to the Centers for Disease Control and Prevention, nearly 15 million Americans now suffer from some kind of form of arthritis. It equates usually to 1 in 5 people over the age of 18. And it's characterized by this stiffness, aching, hard to move joints and bones. The common most type is osteoarthritis, but unfortunately children are affected as well. So let's take a look at the common symptoms of juvenile arthritis, which is the joint pain, signs of inflammation and swelling, stiffness, there may be decreased range of motion and loss of flexibility. But at the onset of juvenile rheumatoid arthritis, visible symptoms are quite vague. So you don't see a direct diagnosis. Your child may be just lethargic and tired, maybe presents flu-like symptoms, maybe lack of appetite. But the first visible sign that something isn't right is the limping. So your child starts to limp. And you think like maybe it's a sport accident, or, the bones start to grow and it's painful sometimes. No, these are the signs. Afterward, the typical symptoms of rheumatism include, of course, the pain, the swelling, the stiffness of the joints. And usually the small joints are affected, like in the hand, the feet, the wrist, the ankle, the knees. Usually the stiffness in the joint is marked in the morning on waking, and then it gets better as the day advances, so continued movement makes it better. So what are the causes of juvenile rheumatoid arthritis? Well, it's not quite clear, but it is considered a disease of autoimmune origin. So what does it mean? Normally the immune cells of the body get activated when the body is invaded by foreign substances like the bacteria or the virus. And the immune system knows exactly what to do. It fights these external forces to exclude the infection. Now in autoimmune diseases, the immune cells start destroying the healthy body tissue from this misdirected response within the body that makes them see that these tissues are harmful or foreign. And in juvenile rheumatoid arthritis, the immune cells start destroying the synovium of the joint, so the lining. What triggers this response, as I said, it's not quite clear. Genetic, lifestyle factors, environmental toxicity. But in my experience and clinical practice, I see a lot of direction and link here with the digestive system, right? If there's a leaky gut syndrome involved, food allergies, obesity, that is definitely something to have a look at. Juvenile arthritis can be running maybe a short time, but in other cases it becomes more chronic. So the combo of lifestyle changing, bettering the diet, bringing in supplements as well as homeopathic remedies, which halt the further progression of the disease by moderating an overactive immune system, is really suggested here. What are the complications of juvenile arthritis? The first among are the eye complaints. A major eye complaint is an inflammation in the front of the eye. We call it uveitis. And if not treated in time, of course, that can lead to permanent eye damage. So it's very important to have a hold on this. But also we see joint contractures because the child with arthritis will position the affected joint in the most comfortable place. That means it bends the joints in order to avoid movement. But as the child still develops and it's in the growing stages, this causes shortening of the muscles and the tendons, which eventually leads to these joint contractures. So we see joint deformities, muscle loss, muscle weakness, and osteoporosis among other symptoms which lead to arthritis in children. But as already mentioned, experts still don't know, what is the concrete cause. So we have this multifactorial aspect from genetic susceptibility, obesity. It's really important if your child is obese, please make sure that that can be tackled here as well. Injury, repetitive movement. So if your child sits in front of the PlayStation for hours and moves his fingers like a maniac, for hours, this is repetitive injury. That could be a part of it. Infections I mentioned. And definitely there is a clear link with inflammatory arthritis to gut health today, which means healthy diet is really the key for recovery here. So what are the conventional treatments? Well, the most common type of treatment for arthritis are usually pharmaceutical drugs, and those prescribed are more called analgesic, but they really only treat the pain. They don't treat the overall cause, and therefore a targeted treatment plan is really important here. If you are interested in a health consultation either for yourself and or your children, contact me at Medica Nova at health@medicanova.net. Medica Nova is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. Book your appointment today. Let's move on to the second part of this video called Food for Thought or Metaphysical Meaning. As with all of my videos, I would like to take you a little bit behind the scene of the physical expression or the symptomatology. We do have a mind-body connection, and with arthritis we see rigidity of the joints, stiffness, so there must be some kind of rigidity in the thinking process, or not being able to move forward because of the deformities of the joints maybe. So you see that, this kind of stiffness and rigidity is actually expressing itself on all aspects within your beingness. I like to refer to the references of Jacques Martel's. And here he says arthritis is defined as the inflammation of a joint. It can affect each of the parts of the human locomotor system. It is characterized by inflammation, muscular stiffness, and pain, which corresponds on the metaphysical level to closing criticism, sorrow, sadness, or anger. Symbolically speaking, grace and freedom of movement are the main qualities related to joint. And when it becomes inflexible or hardens, arthritis is associated with a certain form of rigidity in my thoughts. We call it crystallized thoughts, right? They become hardened, my attitudes or my behavior, so that all the deep emotions that I should normally be able to express are now conveyed instead by the physical manifestation of this disease. And this arthritis occurs if I'm too inflexible, too demanding, obstinate, intolerant, very moralistic, critical, restricted, or too proud towards myself, others, or the situations of my existence. There's a feeling of powerlessness, usually accompanies the suffering that holds me back. I feel restricted by the system in which I live, and I criticize the authority that violates my freedom. Does it sound, familiar? That's a teenage behavior, right? It's classic. So, everybody's against me, nobody loves me, my freedom is restricted. So if your child or your teenager expresses joint problems, and this story is really predominant, they match, right? You have to also deal with the mental, emotional aspects here, because it is an autoimmune disease, right? You want to deal with the underlying causes. Life is an eternal fight, a struggle of every instant. I experience the feeling of being badly loved or not being loved and appreciated at my real value, which gives me much disappointment, bitterness towards life, and bad moods. I then show an exaggerated rational attitude. I often criticize anything at all because I'm afraid of life and often feel a form of chronic insecurity. I feel exploited. I carry out actions more in order to please others than out of my true will and interest, and I end up saying yes out of duty, whereas my true answer would be no. I call myself a victim, but this suits me because I can thereby attract attention. I feel powerless, and I hold others responsible for my calvary. I may resent the whole world, and especially those I love, but it is actually myself that I resent. I'm afraid of the gentleness, the tenderness, and the love that inhabit me. I may have experienced childhood trauma, and here I want to say, look into that too. Right? Has your child experienced some deep affecting emotional event, a divorce of the parents, separation, loss, that all can be part of that. And therefore, I now repress my emotions a lot in that experience, and I permit myself, maybe unconsciously, to blame and complain so that others may understand how much I suffered. This manifestation is related to the self-sacrifice complex. Arthritis can also come from the way I treat myself or how I treat others with respect to criticism. It can also be a sort of retrograde action. I have the impression of being recalled to the rear, right, to the end of the line, so to say, as if I was being told to do something else in a different direction. Joints get contracted, right? You can't move forward instead of going forward. Because my fear, my low self-esteem, and my rigidity all conspire to raise deep emotions about the why, the how, or the direction of my movements in life. I may have the feeling that I am constrained, restricted, immobilized, or boxed in. You see what I'm saying, where I'm coming from? I will then find it difficult to bend my attitude to be mentally flexible or capable of giving in. Right? The joints get stiff. So what would be the positive affirmation? But from now on, it says, I accept to test my true intention about love. I must change my way of thinking and adopt a new attitude toward the situation in my life. And by remaining open to the love that is omnipresent, is everywhere, and by expressing it more honestly, freely, and spontaneously, my heart will be radiant and I will respect others as much as myself. Friendship, understanding, and forgiveness are now available to me. And I accept that the only person over whom I have any power is, of course, me. I see myself as the center of my life, and the others are only a reflection of how I treat myself. By taking good care of me, the others will do as much. It's not easy to see that story directed to a child, but definitely with teenagers, I can see that very, very clearly. If you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths qualities in achieving the very best of you, then contact Medica Nova Wellness Coaching at health@medicanova.net for your 3 months coaching program. I am coaching you to be well. Let's move on to the natural treatment section of this video. With adults who suffer from arthritis, I can bring up a whole treatment protocol list here with physical exercise, losing weight, lifestyle changes, bringing an anti-inflammatory diet, and so on, which is great. But with children, it's not so easy. So really the main part here is if there's obesity, try to make sure that your child has the correct weight, bringing anti-inflammatory diet, and of course physical therapy on a weekly basis would be suggested. But here I want to bring in straight away the natural supplements and homeopathic remedies. The first supplement is fish oil because it really quenches the inflammation within the body. I would say 1,000 milligrams. If your child can swallow capsules, would be great as well. Turmeric, I like here as well. It's a powerful anti-inflammatory agent. Can sprinkle it on the food, but 1,000 milligrams, daily recommended, particularly in acute situations. Any pain within the body is really met and ameliorated with the combination of proteolytic enzymes and combination of fish oil or omega-3, 6, and 9 oils even. It's a great combo and it brings down the pain levels. So proteolytic enzymes, I would say as well. If your child really is advanced already in the rheumatoid arthritis, I would bring in glucosamine. Glucosamine sulfide is very effective and is actually giving your body the sort of nutrients and things it needs for rebuilding healthy joints. Others suggest MSM, which is a form of sulfur. I don't give that so much to children, really, because often there is an allergic reaction to sulfur, so be careful with that. Externally, if you want to put in or apply some external creams like camphor or eucalyptus, as well as Proteolytic Essential Oil, which is frankincense oil, fantastic, really cools down the inflamed joints. But there's something with it. If any strong smelling substances in terms of creams and gels, particularly if they contain camphor and eucalyptus, can antidote the homeopathic remedies. So you have to wash your hands very carefully if you then pass on the homeopathic remedies to your child as well, because you could antidote it. So I want to share with you really effective, targeted, individualized homeopathic remedies here, which you can get hold of and purchase in your health food store as well as online. They work very well here because they halt further progression of the disease, of moderating this overactive immune system. And it shows really promising results in juvenile rheumatoid arthritis. And these remedies are natural, and therefore, of course, have no side effects. They're safe, but they're very effective, especially with children. They focus more on helping reducing the pain, the swelling, and the joint stiffness. And of course, the ideal remedy is chosen when you take the case. So you need a professional homeopath, so you can contact my practice, Medica Nova, at health@medicanova.net to make your appointment, or contact your local homeopath. But in this video, I want to focus on the most common indicated homeopathic remedies, as I said, which you also can purchase. I think the potency with children, 12C and 30C, would be appropriate here, depending on how advanced it is. So maybe a 30C, one tablet, you can give it maybe one or two twice a day, morning and evening, or once a day for 10 days and see how that works. But usually with this kind of autoimmune diseases, you want to give the tablets at least for 2 to 3 months or longer in a lower potency. That works much better. So the first remedy is called Rhus toxicodendron, or Rhus tox, and the keynote here is the stiffness of the joints. Rhus tox is one of the top grade remedies for juvenile rheumatoid arthritis, and we have here the joint stiffness. The child who needs Rhus tox has stiff joints that are worse in the morning, and continued movement makes it better. Along with the stiffness, the pain and the swelling in the joints are very predominant. And the child maybe gets a relief with warm applications, right? Like a hot water bottle or just massaging the joint. As I said, walking or continued movement makes it better. Sometimes the weather changes affect it too, like if the weather gets cold, right, or damp, that can affect the joint pain as well. But that's the first remedy which comes in mind, and it's usually very effective. Another one is called Aprotanum 30. It's juvenile rheumatoid arthritis when we have severe pain. So here the child is unable to move the limbs from pain, or there's even lameness from pain, is also quite well marked. And there may be emaciation or the thinning of the lower limbs because the child doesn't move the limbs. I've seen that with aprotanum, that the rheumatism can maybe come up from, we call it check diarrhea, that there's again this digestive system link involved here, but it could be helped. So the keynote here is extreme pain, severe pain. Rhus tox has more the stiffness. Now, if you have excessive swelling of the joints, then we think about Bryonia alba. Wonderful remedy here as well. Joints are very swollen, marked inflammation of the joints, and the joints are even hot or extremely painful. And the keynote here is that even the slightest movement makes it worse, which is completely opposite to Rhus tox, where continued movement makes it worse. So the first movement, the stiffness comes about, but then continued movement makes it better. With Bryonia alba, it means any slight movement makes it worse, right? So the child wants to therefore rest, right? Bend the joint, don't move it. So Bryonia would be a good remedy here. We have another remedy called Colchicum Autumnale 30, and here again the pain is worse on slightest touch. Even if you just put your fingers on the joint, the child will really let you know it's painful, particularly on the fingers, the toes, the wrist, or the ankle. Again, we see this joint stiffness, hot, painful, and swollen, but it's very pronounced by slightest touch, almost like aprotanum, but here it's almost worse. Colchicum is very effective here. If you see your child has shifting joint pains, right? So the pain appears in one joint, but rapidly shifts then to another. That could be a remedy called Pulsatilla nigricans 30. Usually the rheumatism gets triggered from getting wet. It's also a major deciding factor here. And Pulsatilla has a certain personality. The children are clingy, very sensitive, cry easily. So if I see that, then I maybe give Pulsatilla as a constitutional remedy in a higher potency, maybe once a month, but on a daily basis, low potency Rhus tox like 12C. That would be a great, a really nice treatment protocol, because it hits the personality as well as the symptom. If you see in your child that the arthritis started in the lower limbs and now ascends upwards to the upper limbs, it's Ledum palustre, the 30, a great remedy here as well. Again, we see painful joints, particularly at night. Warm applications actually worsen the pain. Your child would ask more for ice cubes or ice packs on, because it's so inflamed and it wants to cool down the inflammation. Again, we see swelling of the knees, the feet, the ankles, and even you can see even this diagonal shifting pains from the left shoulder to the right hip. Right, that could be Ledum palustre as well. So, of course, these remedies are indicated for adult arthritis as well. Don't get me wrong, it's not just for juvenile arthritis, but these remedies would be specific, indicated for children. We have remedies for advanced stages as well, where we see then deformity of the joints, and we have here a remedy called Colchicum or Guacum officinale. Here we see really advanced stage with contractures of the joints, deformative, stiffness of the joints. But of course, here you would need a professional homeopath. I'm not saying that these remedies can change the deformative or straighten the contracted joints, but they definitely help to halt a further progression of the disease. I think that's worth the shot, even just on that level. So I hope that this video has inspired you again to seek out more natural solutions. And I believe with the right lifestyle changes, physical therapy, change of diet, bringing anti-inflammatory diet, natural supplements, as well as the homeopathic remedies, you will be able to help your child managing and healing juvenile arthritis. It is possible. So if you have any questions about the suggested treatment protocols, or you want guidelines how to take these remedies, contact my practice Medica Nova at health@medicanova.net to book your appointment, and go to my website medicanova.net at the online academy, where you find fantastic home study online courses. So till next time, much love.